Some people just cannot swallow their spit. Some people can't just find their tongue friendly. Some feel like cutting off their tongues and throwing it away because they just want to be comfortable. Hello everybody, welcome to pregnancy week by week, and today happens to be week 4 of pregnancy. So if you haven't seen any of the videos or the previous videos, you can check in the playlist to see the previous videos so you catch up on week 4. So my name is Jovita Abala. Welcome to pregnancy, week 4 of pregnancy. So if you suspect that you are pregnant, you don't need to wait for any reason. The first thing you should do is to consult your doctor or go to the hospital or meet any medical professional that will examine you and ensure that the right steps are taken in your pregnancy journey. So the moment you find out you are pregnant, well, the first thing that comes to your mind is, am I really pregnant? I've missed my period, or what exactly am I supposed to do? You go haywire. If you're an expectant mom, you're like, oh, it has really happened, but I have to be sure if this is really true. And if, for instance, you're one of those women who are blessed with another baby and they weren't even expecting to have a baby, to be like, hey, am I really pregnant? So the next thing you have to do, or the first thing that comes to your mind, is visiting a local pharmacy to get a pregnancy kit. Now, this first period of your baby's life is really essential, or really essential, paramount, crucial, vital, whatever tough word you want to use for it, go ahead and use for it, because if you're able to have that in your consciousness, you will be very careful about the kind of decisions you take. Decisions concerning your eating, drugs you take, the environment, and the things you expose yourself to all do matter in the case of pregnancy. So the first few months of your pregnancy has a crucial impact on your baby's development. Your baby's heart, the lungs, and a lot of internal organs are beginning to develop. And at this point, your environment and so many things have an impact on the development of your baby, and you don't want to ruin that for your baby. So your baby is directly vulnerable to substances like tobacco, drugs, and alcohol. So you have to be very careful about the things that you take. At this stage, you are actually aware of early signs that might indicate pregnancy, and I'm sure in most cases it brings about anxiety. Testing for pregnancy. There are many test kits across the counter, and they work by detecting a particular hormone in your urine, and I'm like, we just go ahead and use the test kits, and something shows and we feel we're pregnant, or we're not pregnant, or it is not certain. What exactly is it that indicates itself in the urine to show us that we are pregnant or not? You know, as time goes on, most people who are not medical practitioners or have nothing to do with medicine have to get themselves educated. In fact, the system gets you educated. It's now left for you to get yourself educated or not. If you are inquisitive about a lot of things, you have to learn a lot of things as time goes on, because you can pass on that knowledge. So what exactly is it in the urine that triggers or shows off if you are pregnant, not pregnant, or uncertain if you are pregnant or not? There's just one hormone that is responsible for that, the human chorionic gonadotropin. And this hormone is produced by the developing embryo. Isn't that lovely? Time to test. Pregnancy tests can be done 2 weeks after conception, around the time of your next period, and it's advisable to wait 4 days after you have missed your period, because some people have their periods late and some do have irregular periods. Seeing your GP. Now, if you don't know, the GP is your general practitioner. So let's just say seeing your medical professional. What will you be asked when you see your doctor? You know, the doctor will ask you a series of questions to ensure that your pregnancy is doing fine and take records of everything that is required as far as your pregnancy journey is concerned. This does not mean that there is a problem. It is just a routine, and it ought to be done in order to ensure that everything goes fine. So what are you expected to tell your doctor, or what kind of questions will your doctor ask when you go to see the doctor? You will be asked to remember the first date of your last period, and you'll be asked if you are pleased to be pregnant or you have some worries. You'll be asked if you have some allergies or possible allergies. You'll be asked if you smoke and your average weekly alcohol consumption. Your doctor will want to know if you are taking folic acid supplement and if you have had cervical smear recently. Your doctor will want to know if you have any preferences as far as hospital is concerned, or your obstetrician, or the kind of birth that you would like. Now that happens out there. We don't do water birth here in Nigeria. Home birth, water birth. You'll also be asked if there is any sickness that runs through your family bloodline and that might affect your growing baby. Your doctor will want to know what happened during a previous pregnancy and during your labor. That's for those who have had children before or who have had a child before. Your doctor will also want to know if there's anything about your medical history that is relevant with your present condition. Things like, what kind of medication are you taking? Do you have a condition? Do you have a health condition that should be managed? Now, this part of it is very important because when as far as do I say allergies or medical history is concerned, anything that has to do with drugs or medication is very, very important. But some people might just overlook it and expect the medical practitioner to know what is going on with them. If you don't open up your mouth, they would not know how to handle you. Like I, for one, have an issue with anesthesia, and I'm sure there are a lot of people who do have such issues. Well, I'm not sure, but the reason why I'm saying the fact that I'm sure is because I was able to meet an anesthetist who said the same thing, that people or most people have issues with anesthesia, but the anesthetist is supposed to know the exact way to handle it in order to mitigate against issues like fainting during surgery or whatever happens. What happened to me? My pulse became low, I became hypotensive. And when I say hypotensive, I mean my blood pressure became low because an anesthesia was administered to me during surgery. So what happens is I start fainting. If you're not an anesthetic, you wouldn't know what to do about it. Now, so many people just go about administering these medications without being professionals in the field. That is the time, or that's the period whereby you start struggling and wonder what is wrong with my patients. Now this is a story, or this is more like an insight from an anesthetist. You have to be prepared for your patients. Not every patient is the same. There are ways to administer this medication, not to make you leave what you are there for, doing the surgery for, and you start looking for how to resuscitate a patient who has just been anesthetized. I hope I'm right with that. Oh, I'm right. So still on week 4. At this time, you may be aware of so many changes that have happened in your body, or so many things that are not just right with you, and you're suspecting that you are pregnant. So what happens to you as a woman? You may experience spotting. A small amount of blood is discharged from down there. 2, your fetus is now in your uterus. 3, you may experience a strange metallic taste, but not everybody experiences that. It now depends on how you decide to describe whatever it is that is metallic. Some people just cannot swallow their spit. Some people can't just find their tongue friendly. Some feel like cutting off their tongues and throwing it away because they just want to be comfortable. Some feel different ways. So how do you feel in your week 4 of pregnancy? If you're currently pregnant and you are week 4, what exactly are the symptoms you are feeling? So write it down in the comment below and let us get to share this little information with each other. What happens with your baby? So at this stage, your baby cells are dividing and multiplying at an ever faster rate. So from now to the 10th week of pregnancy, your baby can be called an embryo. So at this stage, the cells become more specialized for its various roles or functions. There are 3 layers of the embryo, which looks like an onion ring. The inner layer becomes the lungs, the liver, pancreas, bladder, and other internal organs. The middle layer forms the bone, muscle, joints, and cartilage. The outer layer will make you the brain, the nervous system, the hair, skin, nails, and teeth. Something you need to note: the level of HCG in your urine is highest in the early hours of the morning and 4 days after your missed period. For the most reliable results, do the test first thing after waking up in the morning. We all know that, don't we? So don't take it for granted. If you are able to do the test after several times of urination within the day and it turns out positive, mind you, it is so positive. So if you've come this far and you like this video and it has helped you in any little way, why not just smash the like button and subscribe if you want to be a member of this family? No, why wouldn't you want to be a member of this family? Please, I want to be your friend. Hit the subscribe button and let us be friends. See you in the next video. Bye bye.